Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Andrea Perdomo Morales.
Present.
Donna Honer Quayle.
Present.
Sarah Behrens. Mary Gill. I see Mary is present. Mary, you're muted.
I agree, though. I also see her on the call.
Okay. Mike Gillette.
Here.
Leanne Gingery. Don't see her. Angie Heller-Workman.
Present.
Catherine Reck.
Present.
Eric Schonecker.
Present.
And Robin Unruh.
Here.
Great. I note the following BSRB staff members are also present: David Fye and Leslie Allen. Next, David Fye will read a message concerning this meeting being held remotely.
And Jane Holzrichter is here as well.
Oh,
I saw her in the room.
oh, sorry, I skipped Jane. That was unintentional.
Well, I will go ahead and read a small note about this meeting being remote. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting, as no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended, and we will be conducting this meeting pursuant to the COMA. On April 23rd, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with a subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we started the meeting. There's no one currently on the line, but if I hear someone beep over, I will let you know.
Can you hear me?
Yes, we can hear you, Cynthia.
Okay, but I'm having the same problem I had the other day with the screen freezing on me, so I'm joining from my phone.
Okay.
I think you'll need to admit me from there so I can make sure that I am present.
Okay. I've gone ahead and admitted your phone there.
Yeah, there we go. Oh, yeah. Okay. Oh, no, that's... Sorry. Let me. I'm trying to leave from the computer, so I don't have this echo.
Okay.
Okay.
Okay. We can hear you now. It seems like the echo has been resolved.
Okay, is that good?
Yep, that sounds great.
Anyone else hearing the echo? Okay. Not seeing myself on there, but start video.
Okay.
Okay, there we go. All right. First order of business is the agenda approval. Did everyone receive that in your email? Any changes or additions? And if not, I would entertain a motion to approve the agenda as presented.
I make a motion to approve.
Thank you. Do we have a second?
Aaron is second.
Thank you, Andrea. All in favor? Aye.
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 Oppose? Any opposed? The same sign? Sounds like the agenda is approved. Moving on, we also need to approve our minutes from our last meeting, which was on, which were also submitted with the agenda that was on April 9th. You had a chance to look through those. If anyone has any changes or additions? If not, could I hear a motion to approve the minutes as written?
I move to approve. I
Thank
second.
you. Thank you, Eric. All in favor? Aye.
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 Any opposed? Okay, great. Our minutes are approved. Next, we'll hear from David for the executive director's report.
Okay. Thank you, Cynthia.
Thank you.
Let's go ahead and start with some operations update. First, if you have not visited the website for the BSRB in the last month or month and a half or so, I would encourage you to do so. We are operating on a new website now. We have moved to a new platform with Granicus, and some of the intention behind changing websites was to make our website a little easier for individuals to access when using a mobile device. Our previous website was set up several years ago, and at that time, more individuals were accessing websites using standard, laptops or desktop computers. And there's been over time a switch, and so this should be helpful for individuals wanting to get information and access our licensing materials with a phone a little easier and a little cleaner. The website also has been organized to accommodate individuals who are specifically looking for certain types of services that we can provide. So we've added some buttons to the top of the screen, and any kind of functionality we had before, we really worked with Granicus to preserve. But I think it does have kind of an updated and cleaner look to the website. And so I would encourage you all to check it out. And if you see any issues, please let us know. It's been a fairly smooth transition. We've worked out a few minor issues, but if you do see something, let us know, and we will work to correct that. Second, I wanted to update you on an agreement that we have finalized now with a company called CE Broker. And we've talked about CE Broker a little bit in the past. Happy to announce that we have everything in place, and they are working now with the host of our licensing system to work on an implementation timeframe. And so just as a reminder, what CE Broker is a private company that works with state licensing boards in Kansas and in other states. They've already reached an agreement with the Board of Nursing and Board of Healing Arts previously. And what they do is they provide a free service to licensees. So you can sign up for an account, and then when you complete continuing education hours, you can upload your certificate or whatever documentation you have to prove that you completed those hours, so that if you are selected for audit, instead of sending those materials to the board for review, we would be able to log into the portal through CE Broker, review those materials, and then approve someone for audit much more quickly. It's an added benefit to licensees in that they don't have to hang on to the paper records quite as long either. And from what I understand in the portal, you can assign your hours in certain categories, so you can designate which ones are the hours you've completed for ethics. If you needed to get hours for diagnosis and treatment, you can assign them to that category as well. So it should be a nice way to help out the auditing process. The way the company does make money is they have some higher tier services that licensees can choose to sign up for if they want to, but they're completely voluntary. One thing in the agreement we made sure to have was that this would be a free service for any BSRB licensee, but if they chose to take on a higher level of services, there are some assistance that the e-broker can provide, I think, for a paid service to help connect you to other continuing education courses. And I think there's some other services they can provide, but the base level that we wanted to get for all of our licensees as an optional thing was the free service. So, and it's not a requirement, although I do encourage all licensees to sign up for it when it's available, but it is still a choice. So anyone who wants to continue to do things the way they're doing it now, sending things to our office or doing things by paper, that's perfectly fine. But I do think this will be much more efficient for individuals who want to use it. So in terms of the timeline, they looked at all of our professions and the number of licensees that we have and decided to try to start with professional counseling. So that is the group they're focusing on first. And then after professional counseling, social work will be the second. And then they'll work on the other professions as they go along. So don't have a set date right now when they'll open it up for professional counseling, but I would expect sometime over the next few months. Right now, they're just trying to make sure that they're building the right information into the portal first before they open it up for people to sign up for that. But really excited about that service, and it should be coming up here. Another item I wanted to make you aware of operations-wise. Let's go to some legislative updates, actually. I wanted to make you aware, we talked last time about the Social Work Multi-State Compact being enacted. That will go into effect officially as of July 1st, but we were the 7th state to pass the compact, and at least 7 had to pass it for the Rules Committee to start meeting and for the Compact Commission to start working out the operating rules of the compact. So even though it will officially become active as of July 1st, we won't be able to utilize the compact unless all that framework is put into place first. So this fall, we will have different states naming commissioners for each state for the Compact Commission. They will start holding meetings of the Rules Committee to work out the operating rules. Also, they'll be working on a data system to keep track of everybody who is practicing under a multi-state license. One of the new items involved with this model is that as a public protection, you would want to have somewhere where you could verify that the public could look to see if someone is authorized to practice in different states. And so they are working on a data system based on the other compacts that have been passed. I would say probably people shouldn't expect that it will be fully operational until sometime late next year. But if it does become operational before then, that would be great. But just kind of wanted you to have a realistic kind of. And then just to let you know of one other bill that passed this year that's relevant to the agency. That is House Bill 2745. What that bill does is it exempts military spouses of active duty service members from occupational licensing fees. And it's not specific just to the BSRB. This is for all licensing agencies in the state of Kansas. And it's a nice service for those spouses of military members that are on active duty. But we are working with our licensing staff right now to implement that. That will just be a new item in there. So when individuals go to renew or they go to apply for licensure, it will ask them some additional questions to see if they are a spouse of an active service member. Moving next to some other updates. Since the last time we met, there was the mid-year meeting of the Association of Social Work Boards, and I was able to attend that meeting with Andrea Perdomo Morales. And that meeting was a good conference. This one is generally titled as the educator meeting. There's an annual meeting every year for ASWB and then a mid-year meeting as well. And so had a good first day meeting. Basically, the first day of those types of conferences, there is usually a session that involves the administrators or executive directors of similar boards. Got to have some good conversations with some of those individuals. Sounds like Minnesota is doing some work now in terms of looking at alternate pathways for licensure. And so they're exploring some possibilities with that. And I did receive some news that Minnesota is going to be allowing a alternate pathway for the clinical level of licensure. I don't know a lot of the details about that. I still want to look into that a little bit more to see if there's any restrictions or requirements for that. But it seems like the new model that Minnesota was looking at least as the alternative pathway, was 2 years of additional supervision as an alternative to the examination. But like I said, I'm not sure if that is limited to certain types of applicants or if it be open to everyone or what the requirements are for that. But there was some discussion about alternate pathways to licensure. There was some other discussions in terms of a lot of states trying to convert from paper records to electronic records, trying to better utilize technology. A few more states are starting the process of streaming their meetings, such as Kentucky. They started a YouTube channel and are streaming their meetings now, similar to what we've had in place for the last few years. So we got a chance to compare notes. There was a topic at that conference. There was a lot of discussion on supervision and a lot of states trying to determine if they're a good approach to kind of standardizing supervision or what's required for that or how hours can be collected or monitored. So there was some good discussions on that as well. We received some updates in terms of the examination. We did hear that ASWB is trying to work with the testing provider to provide more locations for individuals to be able to take the test. They did do the switch from Pearson View to PSI. And in that process, we were looking to see, do we have enough locations here in Kansas? And it seemed like there was not a location in the Wichita area. So we did work with ASWB and they did work with PSI. And now there is a location in the Wichita area. So we're trying to listen if there's any areas of concern where people would like us to continue to have ongoing conversations with ASWB. Happy to do that. But they provided some updates on that transition. It sounded like there were a few hiccups earlier in the year, but a lot of those have kind of been tweaked out, and it sounds like things are going pretty well. They still do have the goal that later this year, perhaps, they will be able to potentially launch with PSI the ability for people to take the examinations remotely so that they won't have to go to a testing center. But the time frame for that still has not been fully fleshed out. Still waiting to kind of hear about that. They did provide some information about the social work census. And at the last meeting, we talked about that briefly. ASWB had put out the social work census and was collecting information. Part of that looked at a workforce kind of analysis, and part of that was also going to be going towards helping them look at the areas of focus in terms of building the next version of the examination as well. So appreciate everybody who responded to the survey questions with ASWB and the census. Trying to look for a few more updates in terms of the conference. Know that there are some continuing exam initiatives that they talked about. We've talked a little bit about the partnership with ASWB and the company called Fifth Theory, so that if individuals take the examination and are not successful, they receive a free service through that company that sort of helps prepare them to take the examination again and give them some tools in terms of that process. And they mentioned that there are a few groups out there that are doing research projects that are looking at the disparity in pass rates. One of them from Howard University and one from Western Kentucky University. There should be more information about that. They also provided an update at that time that about the social work compacts. At that time, there had been at least 10 or 11 states that had passed the compact. So as we mentioned, at least 7 had to pass it for it to start being operational. And it would not surprise me if several more have passed since that time. I haven't checked out the most updated numbers on the compact, but we have reached that threshold where the compact will be able to start meeting. But overall, the compact was good. An ongoing conversation continues to be technology and how states can best use technology in terms of regulation and licensing. So we will be continuing to get deeper into that topic this year at some of the other conferences that I'll be going to. And I think I'll pause right here before I go on to some updates from the last board meeting and see if Andrea had any comments she wanted to share from attending that conference as well.
It was a great opportunity to get to know others from all around. So that was great. And David has a very great connection with several individuals there. He was part of a panel, so was able to show off Kansas in a great light by talking about our initiatives. And I mean, there's a lot of interest in the surveys that we were doing with our licensees. And so that was a really eye-opening experience that not a lot of other states are doing those surveys to gather feedback. So thank you, David, for your leadership with that.
Well, thank you. And you're right. I was part of a 3-person panel and one individual was from North Carolina, one was from Arizona, and then I represented Kansas. And we talked about our approaches between different states to topics like supervision, and I shared some of the data from our survey. And we talked a little bit in the survey as far as the transition to telehealth, and shared some information about what other states are doing too. But it was a very good opportunity to talk about that and kind of hear some of the success stories or what other states are trying. But I concur in terms of the data that we have from those surveys, and really appreciate all the social workers responding to the survey and giving us that helpful information. There are some individuals in different states that it's hard to get a gauge sometimes on what is going on out in the field, but collecting that data and really hearing from social workers was really, really helpful. And there were a lot of different states that asked us about that. And those reports from the 2021 survey and the 2024 survey are posted on our website under resources. We have a section of the website that individuals can go to that's called publications. And right now we have both of those reports available for review. So I've been directing people to those, but really, really positive conference. I'll move next to, let's talk about some items from the last board meeting. I always try to keep the advisory committee members informed about big items that the board has been discussing. At the last board meeting on May 13th, there was, the board did do a roll call vote to adopt some proposed changes to regulations. There are about 11 regulations that the board had been working on and that are at the finish line in terms of going into effect. Most of these deal with the educational requirements for licensure for about 4 or 5 of the professions. Some of this has to go with the discussion about the in-residence topic that we mentioned last year. So for the schools that when individuals go to collect their education by attending different programs, if they attended a program that's not accredited by a national accrediting body, we do have regulations that specify program level requirements and coursework level requirements to try to gauge something that would be substantially equivalent to having attended the national accredited program. And one of the requirements historically has been that some of the coursework would have been attended while in residence, which was defined as being physically at the school. And the advisory committees and the board had recommended updating that and opening that up so that the in-residence requirement could be met either by people physically there at the school in front of core faculty or face-to-face by synchronous video conferencing. And again, that's just for the individuals who receive their education from a non-accredited program. For the social work, it also wouldn't include individuals who were in candidacy for accreditation. It really is the individuals from non-accredited schools. So it's a small handful of people for most of the professions, but this will help us out as far as applicants, primarily from schools like individuals applicants from professional counseling programs, addiction counseling programs as well. So this will help us license more of those individuals and help them meet the requirements. There was a couple changes the board did make as post-hearing changes. One has to do, there's a legislative committee that reviewed our proposed changes, and they had an issue with the word synchronous, and they asked for some additional clarification on what we meant by synchronous video conferencing. So the board did vote to adopt some clarifying language that synchronous, basically it means real time. And that's what we mean by that. And then also in the addiction counseling regulation, there was one of the regulations that talked about the manner in which something would be provided. And one of the educational requirements for licensure used the term substance use. And in that context, the advisory committee had recommended that term be replaced with biopsychosocial. And the committee expressed a little bit of confusion on that term and asked us to further clarify it. So we just clarified in that context, the term biopsychosocial would mean the biological, psychological, and social well-being of the person. And so we did add, the board did adopt the post-hearing changes for those two terms, and then did a roll call vote and adopted those. They were published in the Kansas Register on June 6th, and by law, once they're published, they would go into effect about 15 days later. So they are scheduled to go into effect as of this Friday, June 21st. And when that happens, we'll publish information on our website, and we'll send out a message to some of the schools to let them know about the new criteria for licensure. Additionally, at the board meeting, the board reappointed several advisory committee members. For the Social Work Advisory Committee, they reappointed Mike Gillette, Leanne Gingery, and Robin Unruh. As you may recall, advisory committee terms are 2 years and they're staggered. And so any members who weren't up for reappointment this year will be up for reappointment next year as long as they still have terms remaining that they can serve. And so if any individuals have terms coming up next year, I'll reach out to you in the spring to see if you're interested in seeking reappointments, and then we can help you out with that process. So congratulations to those members who are reappointed. Additionally, the board has a designee on a group called the Kansas Fights Addiction Grant Review Board. When that group was created, the board was able to appoint an individual to serve as the board's appointee. And what that group does is it considers grant applications to provide addiction type services, and the money that it oversees comes from federal lawsuits on opioids. And so Jason Hess has been the board's designee for about the last 2 fiscal years. And when the board appointed him, they decided to revisit appointments every 2 years. And so they heard a report back from him and decided to reappoint him. So he will continue to serve as the board's appointee to that group for the next 2 years. In terms of other items, just want to make you aware of, at the last meeting, I believe we talked about the alternate proposal for a jurisprudence examination, whereas some states do require a jurisprudence examination in terms of a license requirement. In Kansas, we do not currently have a requirement for that, but some advisory committee members had discussed the value of having that, but we did not want to add another requirement for licensure, and we did not want our licensure applicants to have to pay another fee. So as an alternative approach, what we had proposed was this is something perhaps the BSRB could do as a service to applicants and licensees, and do these as 1-hour live webinars for each of the professions, and put together questions that would be similar to what you would see on a jurisprudence exam, and offer it for a 1 hour of continuing education, and use that as a motivator and make it completely optional, but encourage licensees or applicants to attend those webinar type events. And then we could track their attendance, and then at the end provide them the documentation to support the hour of CE credit. So I mentioned that to a lot of the other advisory committee members, and there was also a lot of support for that. So I think we'll be going forward with that this fall and figure out the best approach in terms of implementing that process. Cynthia,
David?
you have a question? Mm-hmm.
Yeah, just a comment. I think that it could be additionally billed as really good risk management for people who are independently licensed and insured, in addition to the free CE. It's another draw.
Yeah, that's a great idea.
Mm-hmm.
Well, the last item from the board meeting I'll mention here is the board is currently receiving licensing services through the assistance of the Board of Healing Arts. Our licensing database is through IMLO, my license office, and system automation. And the state last year passed a bill that would create what's called an enterprise licensing system for any other licensing boards that would want to sign up for a new system under a group called ACELA. And we had been receiving information on the possibility of switching to that new website or the new licensing system. However, we knew that there would be significant cost in transitioning from one licensing system to another. And we were seeking clarifying information on how those costs would be paid for, if that would be something we would need to absorb or something we could use other money for. And then also we were waiting to kind of get more information on the ongoing costs of a system like that. But some of the benefits of this new system under ACELA would be we'd have some additional features we don't currently have. We are not able to have individuals apply for licensure electronically, but we would like to move that direction. We do have the online renewals, but we would like to have more processes that are online and more that are integrated. Right now, when individuals apply for licensure, we do have a payment portal that we have developed on our website, but a staff member has to manually go in there and track the payments for the person, and things are not as efficient as they could be. I'll just kind of say that. We have made improvements, and I'm happy with those improvements, but this system would offer us things that we don't currently have. But the information that was provided to the board from the Office of Information Technology Services and also from this company called ACELA, and really researching this, it turns out that the implementation cost will be paid for through some federal ARPA money related to the pandemic. And so that was a nice benefit. And then also the legislature passed a bill this session that would pay for ongoing operating cost of the system for at least some agencies that moved over. And if we did move over, they would pay for our ongoing operating cost as well. So that was a really good factor, really beneficial. Right now, we pay about $72,000 per year for the hosting and support of our licensing system. So what that means is that, well, ultimately the board did vote to move to the new system. And so that will be a process that will largely be done behind the scenes. And based on the other agencies that are already in the pipeline to move over to Acela, it'll probably be about 2 years before we have fully moved over to the new system. But it should be a really nice transition, and it will provide us new processes. And once we have moved away from our existing system to the new system, we will expect to see some savings going from the $72,000 per year to having those covered by the state. And what that means for our licensees is that, you know, the board lowered fees back in 2019, and since that point, our operating budget has been at a deficit. So we are spending more money than we are bringing in, and that was by design to lower the balance in the fee fund. However, the faster that we lower that balance, the more quickly we will have to revisit fees to kind of figure out the balance between operations and expenses. However, if we continue to see savings like this with the licensing system, that slows down that time frame. And the longer we can go without having to consider raising fees for licensees, the better it is for everybody. So we will continue to look for things like these types of efficiencies, but this will be a nice benefit in terms of being able to hopefully prolong that a little bit longer before having to revisit any kind of a fee increase to balance out our revenue and expenditures. So, and then I did include one more item in your packet. That is a report from ASWB. It marked for May 29th, 2024, and they did publish some information on their website about a survey that showed support for preserving the social work examination. And basically what there was an independent survey done by the American Foundation of Research and Consumer Education and Social Work Regulation that we found that the majority of social workers that were polled, or 76%, believe that the licensing examination is crucial for maintaining high professional standards. And it noted on here, in addition, 96% of social workers that were polled are in favor of a proposed multi-state compact that will allow tested and licensed social work to practice in all states that have adopted the compact. So just kind of a short summary of the findings from that survey, but I thought it might be helpful for you to receive that information as well. So feel free to review it at your leisure. And with that, I'll go ahead and end my report and see if there's any questions. Sorry, Cynthia, I think you're muted right now.
Hearing no questions, thank you for your report, David. And those are some good changes that are happening. Good to hear. Okay, so we decided that we were going to, maybe we should have done this back at the agenda approval, but we were going to reverse the old and new business today because we have quite a number of applicants to join this committee, which is great news that we have that choice, but it does require us to look through and a number of letters of interest and resumes in order to make a decision. So I think first we should review the advisory committee policy, which I believe that David attached to the email with all of the materials for this meeting. And my memory, David, is that we have 10 non-board members possible, as up to 10. Is that correct?
That is correct. Mm-hmm.
And we're going to have 3 slots when the members who will currently be rotating off at the end of June, right?
That's right. Yeah, currently there are 9 board members that are non-board members currently, and Angie Heller-Workman and James Holtz-Richter are coming off the advisory committee at the end of June. So as of July, there would be 7 non-board members on the board.
So that means we could select up to 3 of these 15 to join the committee. And David, in our planning meeting, you talked a little bit about a strategy for for us making these decisions. Can you share that with the rest of the committee, please?
Sure. And first, as Cynthia mentioned, you have a copy of the advisory committee policy, and there is some language in that policy to help provide some direction when you're considering applicants. So I always think it's helpful to kind of highlight that language. In the policy, under the section that is labeled selection, it says,
Mhm.
in reviewing nominations, the committee should work to ensure there is diverse representation, including but not limited to geographic setting, gender, culture, and ethnicity. Members should provide representation of the levels of licensing for that discipline, and those members should be selected from among public and private practitioners and educators. And I know it can be difficult, especially when you have quite so many applicants. The advisory committee policy doesn't say specifically what format you have to follow in terms of recommending new advisory committee members, but what I've seen usually work the most effectively is if advisory committee members, share a few applicants they thought that stood out the most to them, given the factors that you're looking at, and then we can kind of keep track of individuals that are mentioned and then kind of tally which individuals tend to have the most responses. And then you could officially take a vote to recommend that certain members be added, or if it's a clear consensus, you could also do it by consensus as well. So I had sent a message to the members of the committee with the list of all the names of the individuals, and in that email I also provided that I had verified that each of them is currently licensed in Kansas, and their level of license that was provided. And when we talk about geographic representation, generally how most of the advisory committees have interpreted that is geographic representation across the state. So if you look at that email, I also looked at the 7 members of the advisory committee that would be on the advisory committee after July 1st. And I mentioned their level of licensure and then also what area of the state they are from. And so that might help you when you're looking at other applicants, kind of seeing what areas are represented on the advisory committee. And but there's a lot of things to weigh in this process. So usually I don't participate in terms of talking about which individual stood out to me. But if you do have questions from a technical nature as you go through this process, feel free to ask and I'll help facilitate this as best I can.
Okay, so then it sounds like what you're suggesting is that we go through each of us and name applicants that we stood out to us and see where we might have some repeats of that. If there are some candidates that stand out to multiple of us right now.
That could be a good approach. Yep.
So how does the rest of the committee feel about that way of selecting? Have you all had a chance to read through the resumes and letters of interest?
Yes.
Yes. Yes.
Okay. So is this a good way for us to try to parse out who we want to invite to join the committee, to each of us say 2 or 3 names that stood out to us?
I think that's the way we did it last time, and it worked really smoothly.
Okay, great. I haven't gone through that process before, so I'm glad you've had that experience to know how well it works. Excellent. Okay, well, I'm going to invite you then to go first and tell us 2 or 3 names that stand out to you. Again, we can select up to 3. We don't have to have 10 non-board members, but we can have up to 10.
Okay. So I was impressed with Jasmine Cohen-Young. That was one.
Can you tell a little bit about why you feel like she stood out?
She has a very nice resume that really shows a lot of leadership ability. She, with us going into multi-state compact in the future, she is represented from Georgia and Kansas. She also has the diversity that we're wanting. but also in not only in work, from a mental health, from a school, medical. She really brings a lot of the criteria that I think comes to our table in making decisions about many different disciplines within the social work license. So she also has her doctorate. I think this is the one that had her doctorate.
Yes, it is.
Yes. Okay. So so she's been through many steps of our licensing levels. So she was impressive to me.
Okay.
I think she comes from, I'm not for sure where she lives actually.
Manhattan area. Well,
Manhattan area.
let me
Okay.
go, because she's with Fort Riley, which is what that was another component I thought was good. The
So she
military.
stood out to you as well?
Yes, she
She was
also
on-
was on my list too.
She
Mine
was
as well.
She was on my list too.
Okay,
She
great.
was on mine too.
Wow, that's 5. Excellent. Okay. She does work at Fort Riley, and she has her Minds Matter business that's about sports social work. All of her work right now, according to her resume, is remote. So she may live in Manhattan, but she's all the work is actually remote, according to her resume. Okay, well, that's a lot of endorsement for that candidate. Who else? Was there just the one that?
That was the one that really stood out to me. And I think there is several others, but let me hear from other people before, and I'll see if I weigh in on.
Okay, all right. So we can go through and just have everyone name the first one or the one that stood out the most and see what consensus we have. Okay, let's see. Who would like to go next?
I can
Andrea? Or Eric? Thank you.
The next one I had was Heather Eichmann. And so she was in Lawrence, another kind of metropolitan area, but it was further north. That was one of the things that stood out to me. She had a pretty big wealth of experience through case managers, directors, including look like she's works with the Potawatomi Nation, so that would give some opportunity maybe to integrate some other perspectives that we currently don't have.
Mm-hmm. And I believe both of these are LSCSWs.
Yep.
Unfortunately, we don't have any BSWs that applied. So all of our candidates are LSCSW or LMSW. So you thought because of her unique experience with Native peoples and also her location stood out to you a good move towards adding some diversity. Although I do note that we've got, of the remaining 7 of you that are that will stay on after July, looks like we have pretty good spread of where everybody's located. So, but we don't have anyone from Lawrence, and we won't have anyone from Manhattan. So both of those would be good additions. So anyone else have Heather on their list?
She was in my top 10.
I did.
Top 10. Okay.
I like the Native American aspect of this. This is an under-recognized population, and to be able to put somebody on that has some experience and some professional experience there, I think that would speak well from a state level. So I'm going to say yes, she's in my top 3. I'm going to go with Erica now.
Heather is okay.
Just based on some of her professional and diversity.
Okay. Who wants to go next? Mary, Gil?
Yeah, a couple more people that I had on my list were the woman from Newman Johnson, being involved in higher education, being out in Wichita. And the other person, Kennison, from the Wichita area, who works with Rainbows United, which is kind of a different. I just like that different aspect of serving children. I mean, it's part of child welfare, but it would be a little bit different. But those two, and plus getting more, serving more of the mid part of Kansas, I thought would be good from where
Yes.
people live. And not that they're rural, they're not, but still they're out a little further west. So
Yes.
And Mary, I'm sorry, you said the first one was last name Johnson and
Johnson,
the second one was
yes,
Yolando Johnson.
she has her doctorate in
Yes.
education though. So there's a little different, but she's at Newman. So you would have the education portion, or the students coming out of school and getting ready to work. So those two were
She was
also
on my list as well. Yeah, as an academic representing chair of the social work department there at Newman. And a doctoral level, even though it's not a DSW, but she's head of the social work department.
She was on my list as well, and for the CSWE experience that I think would be helpful.
Yeah, that's a really good point.
She was also on mine.
Okay, great. We got four of us for Yolando.
She was in my top 5 as well.
Okay.
Also me.
Oh, great. She's gotten the most votes so far. 6 of us had her on our list. Okay. Mike, did you have a top 3 you wanted to suggest, or one that stood out to you?
I didn't have the list in front of me, so I don't have the name, but the Rainbow United one stood out to me because I really like their program, and it is different than some of the other kinds of things that are going on. But that's the only one that I was really, yeah.
That stuck in your memory as
Right.
somebody. Does anyone remember which person it was that was Rainbow? Where is that?
It is Kennison is the last name. I'm sorry, I just wrote down last name.
Oh, there,
Audra. It's Audra.
Kennison, foster care coordinator and mental health and foster care coordinator in Wichita. And she stood out to you because of what was the program, Mike?
Rainbow United. And that subject, those fields are just really, at least in the areas I've been in, have been very important to try to get help for those families as they go into the adoption. And Rainbow United, I think, has been doing a good job with it. But that's why it's just, I know that there are other programs that are good in there too, but she
her
put her name forward.
Yeah, her foster care experience. We have a couple of other child welfare candidates, but her foster care experience and involvement with adoption services, that's a different area of practice than the other ones that we've been talking about so far. Did anyone else have Audra on their list?
I did.
I did.
Basically similar reasons as Mike.
Similar reasons. Okay. That's good. Let's see. Robin, did you have anyone else on your list?
I had a hard time so the two that have already been mentioned that I agreed with are were at the top of my list.
Okay, so you two of them that we've already discussed were on your,
Yes.
okay. Andrea, who else was on your list? You said that
Well,
you,
I cheated and did not have a top three. I had
top 10,
5 out of the top 10.
5,
Uh,
okay.
So in full transparency, I also know 2 of the applicants, but some that have not been mentioned are Christy Sanders.
Yes, I had her on my list too.
And
So did
then
I.
Someone
Emily
else?
Storton Becker.
I had Christy on my list
You
too.
did?
I
Okay,
had
that's
her on my
4.
list.
That's
have
So did
5.
Angie here.
And you did too?
I did
Yes.
too.
How
Okay,
many
that's,
was that?
I think I have 6
6. Okay.
of us that had Christy on the list. And let's see, she's from Wichita, and she was one of the child welfare candidates or people with background in child welfare, which I thought was really important to represent. And she also said that she was concerned about the lack of license or social workers and licensed social workers in that field in particular.
Mm-hmm.
And so that was a particular reason she wanted to participate and on the committee and see what might be done to support and encourage child welfare social workers.
And this is Angie. I like that as well because being the bachelor social work that's no longer going to be on the representation of the board, I feel like it's good to have that level to remind everybody that there's us in the
Yes,
front. So
absolutely. And of course, that's, was child welfare is some of the oldest roots of social work. So I think it's important to have that field, that part of our field represented.
I
Okay.
also liked Emily Stortenbecker just because of her background in school social work.
I agree. And
But
also,
I
in
just see that
KPK.
growing and growing.
Yes. I had the privilege of working with Joan. I'm blanking on her last name now, who was the first social worker in Shawnee Mission School District. And when I was a school social worker there for 5 years, and yeah, it's grown a lot since then and needs to grow a lot more. There's not gonna stop being a need for that.
Yeah, Donna, I had her on my list as well.
Okay.
And then I also had Bridget Mabeck with her experience with domestic violence and children and families as well.
I had Bridget as well because of that.
And
Yeah,
I had her because she does mostly telehealth.
Oh, that's a good point. The wave of the future, right?
She was
She's in-
also multi-state licensed, which could be helpful.
Yes, she's licensed in several different states, as were several of our candidates. Hopefully they'll all be able to switch over to a multi-state license and not have to maintain 3 or 4 different ones like they are now in order to do telehealth. So we had 3 people that had Bridget on their list as well. There was one person who, while we're talking about the tech aspect, that I had Caitlin Holmes, who's an LMSW, and she is the head of the SAMHSA Region 7 Addictions Tech Transfer Center, which actually operates out of UMKC, but she is licensed in Kansas. And so, we've been talking about off and on about tech issues and how that might be impacting our future practice. And so I thought it would be good to have someone with that level of expertise. And also she's working for the Fed, so that's another area that we don't have represented, as far as I know, in our cross section.
Caitlin was in my top 10.
Okay. Caitlin Holmes. Okay, who has not offered a name?
Most of the
Everyone-
people on my list were already mentioned, but I was also trying to look at some of the gentlemen that applied.
Yes.
And I actually know John Hyman as from his work as pastors for long-term care facilities, so that's a bias on my part. But Harvey Hillen had a lot of really impressive items on his resume.
Yeah, he has a lot of addictions experience. And while we have a number of people who have mental health specialty and some including addictions, that seems to be what he's specialized in. And yes, the diversity factor of making sure we have representation, gender representation. Although I think that those were the only two men that applied, if I'm reading my list correctly.
I think the two men we have are the best ones. So.
Absolutely. Absolutely. Okay, so I'm just going to name the other ones that no one has mentioned yet to see if anyone wants to put in a word on any of them. Let's see, Allison Despard, who's in Newton at Prairie View. And we had Lynn Grant, who has some criminal justice background, which we don't have that area represented. Dr. Daphne Kubler-Hoffman in Manhattan. She didn't stand out to anyone. And Jessica Williamson, LSCSW in Overland Park. Okay, so that doesn't sound like any of those stood out to anyone that they wanted to put on their list. So right now we have.
Can I just mention one other person? It was in the top 10 was Allison Despard, and that was due to her dual license as an LMAC and an LMSW.
Yes, I had her down too, partly because of location. She's in Newton. Despard, yeah. Okay, so I've been keeping a tally. So looking at the top 3 vote getters at this point, that would be Dr. Cohen Young in Manhattan. That would be Christy Sanders, who's in child welfare and foster care. And Yolanda Johnson, who's the head of the social work department at Newman and has some CSWE experience.
Is Chrissy from Wichita? I can't remember without going back. I can look.
Yes.
I've got it.
Yeah, she's from Wichita.
She is from Wichita.
Okay.
So that would mean we'd have
Wichita.
We'd have Manhattan, Newman, and Wichita.
Which Newman's Wichita?
Is in Wichita. So we'd have 2 from Wichita area then.
And how many voted for Heather Eichmann?
Heather Eichmann, we had 2 people, a third, I guess 3 that voted for her. And we have a couple of other, Bridget Mabeck had 3. And then we had Audra Kennison, Emily Stortenbecker, Caitlin Holmes, and Allison Despard with 2 each.
Cynthia, do we want to go back through and just make sure we'll raise our hands to take a final?
Yeah, I'm at a little bit of a disadvantage here because on my phone screen, I
can help
only
you.
Yes, please, you can count for me then.
And I don't have visual, so I'll have to say
Okay.
my vote.
Perfect. And Katie too, will you just say yes or no? Yes, or for the ones that stand out to you?
Yeah.
Okay.
We could
right.
start with the top 3 and then work down.
Yes. So we have Christy Sanders actually had 7 votes. That was the highest vote getter. So shall we just go through, just have everyone say if that was on their list?
Okay, Jane?
And sorry, that's just a suggestion here. Since we can fill 3 spots, maybe just have people be able to vote for 3 people. Do you think that would be kind of a logical approach?
We need a transcriber if we do that.
If everybody can just kind of keep track and just don't vote more than 3 times or so, and I'll kind of keep track as we go along here too. So.
Okay. You want me to start?
Sure.
Is that what I heard? Okay. So I'm going with Cohen Young, Christy Sanders, and Yolanda Johnson.
Oh, I'm sorry. What I was suggesting was maybe, for the individuals who were kind of identified in the top, you could just go to one of those individuals, and then anybody on the advisory committee could vote.
Got it. Okay.
By candidate. Yeah. By candidate, right?
Okay. All right.
Yeah. Okay.
Got it.
So let's start with Dr. Cohen Young. And do we need to go through just a roll call vote to have each person, or just speak up and let Andrea see we're here that you're voting for Dr. Cohen Young? Everyone voting for 3 people.
So Jane?
Yes.
Mike?
Oh, you want me to give a name or?
No, vote.
Yes or no on Jasmine
No.
Cohen Young?
No.
Oh, okay. Eric?
Yes.
Mary?
Yes.
Cynthia?
No.
Donna?
Yes.
Robin?
Yes.
Angie?
No.
Katie?
Yes.
And I'm a yes on that. So we have 7.
Okay. Heather Eichmann.
Jane?
Yes.
Mike?
No.
Eric?
No.
Mary?
No.
Cynthia?
Yes.
Donna?
No.
Robin?
No.
Angie?
No.
Katie?
Yes.
And this is Jane. I meant no on that. And I said yes. I confused myself.
You're okay. So we have 2 for Heather.
Yolanda Johnson.
Jane?
Yes.
Mike?
Yes.
Eric?
No.
Mary?
Yes.
Cynthia?
Yes.
Donna?
Yes.
Robin?
Yes.
Angie?
No.
Katie?
Yes.
And I'm a yes on that. So that's 8.
Yes. Audra Kennison.
Just trying to find her in my notes. Okay. Jane?
No.
Mike?
No.
Eric?
No.
Mary?
No.
Cynthia?
Yes.
Donna?
No.
Robin?
No.
Angie,
No.
Katie.
No.
Okay, so that's one vote.
Christy Sanders.
Jane,
Yes.
Mike,
Yes.
Eric,
Yes.
Mary,
Yes.
Cynthia,
Yes.
Donna,
Yes.
Robin,
Yes.
Angie,
Yes.
Katie.
No.
Okay, and I'm a yes, so that's 9 on Christy.
Emily Stortenbecker.
Jane,
No.
Mike,
No.
Eric,
No.
Mary,
No.
Cynthia,
No.
Donna,
Yes.
Robin,
No.
Angie,
No.
Katie.
No.
Okay.
Is that everybody?
Yeah, so that's 2.
Okay. 2 votes. Bridget Mavick.
So is there anybody that hasn't voted there 3 times? Okay, so we just have 2 people. Okay,
Everyone's already voted. Pardon me?
Bridget's my third, so
got it.
Okay. Everyone else has already voted 3 times.
My third was Kathleen.
Kathleen whom?
I can't. She works dealing with the transfer. One of the last ones we talked about.
Caitlin Holmes. Yes, Caitlin Holmes. So that was your third. Okay.
Caitlin, I'm sorry.
Okay, Andrea, by your count, I've got 7 for Cohen Young, 8 for Johnson, and 9 for Sanders. Is that what you have?
That's what I have. David, is that what you have?
That's what I have as well. Yep.
Okay, sounds like we have our candidates.
Yep.
All the others that we named only got 1 or 2 votes, so.
Yeah, and I just want to say from a technical standpoint, the next step in the process, so the advisory committee's authority is to make recommendations in general. And so essentially this is a process to identify the 3 candidates the advisory committee would recommend for new spots on the advisory committee. And so officially the chair of the board has the power to appoint to the advisory committee. So I will take this discussion and summarize it in a letter to the chair of the board and identify the 3 candidates the advisory committee has identified to be recommended for the advisory committee. And then as long as the chair of the board doesn't see any issue or require additional follow-up information, generally what happens is those members are appointed to the advisory committee at the following board meeting. And the board next meets in July. So I will make sure to get it to her so that she has enough time to do that before the next board meeting coming up.
So, David, will there be a letter sent to the other candidates?
Yes, what I normally do is I wait for the official action by the chair of the board, and then if she goes ahead and appoints the 3 individuals recommended by the advisory committee, then I send them notification about the advisory committee and next steps as an onboarding kind of thing. And then I send a message out to the other individuals who applied to thank them for expressing interest in it and let them know that they weren't appointed this time, but encouraging them to apply in the future when there's more opportunities to serve on the advisory committee.
And can we let them know that there were 15 candidates?
That's a good idea. Yeah, and I'll make a note about that because we did get a lot of really, really good candidates who applied for these positions, and we're really limited to just a handful, like less than a handful, 3 spots. And so there are lots of other individuals that I'm sure would do an excellent job on the advisory committee and would bring lots of different, strengths and experience. It's just kind of limited to make sure that the advisory committee has a low enough number that all individuals can be heard. And so there's reasons why there's a limit, but I'll make sure to kind of mention the 15 applicants when I send the message back to them.
Okay, that's great. I think that would be important for people to if we want to preserve their interest in the possibility of reapplying, for them to know that it was a large field and difficult to choose from, because I don't think anybody on this list would have done a bad job. We had to pick, so that's what we came up with. Okay, well, that actually went quicker than I thought it would. So we can go back to, should we go back to old business and discuss? We didn't really prepare to talk about the results of the survey any further when we talked in our planning meeting, because we were thinking this election was, or this selection was going to take a lot longer than it did. David, were there specific things in the survey that you had thought we would want to follow up on?
I would just, not that we need to get into today, but some people say they really want to make decisions that are data-driven decisions, and we do have some data from the survey, and we've talked about some of the input on certain areas, but I think that there is still some area to explore there. Some of the open-ended responses on the survey to some of the questions about supervision in particular. So what I would encourage the advisory committee members to do is, maybe, let's say for the next advisory committee meeting, just continue to review the results of that survey and note some of the individual responses that we got back, and see if you notice any issues that maybe the advisory committee could explore in terms of trying to find a solution to some of those issues that were identified. So we did get some good input, and some people from different states have asked about the report, which we provided to them. But since we have that data, it'd be nice to kind of continue to review that, let it be something that would drive some of the work of the advisory committee going forward.
Yeah. Okay. I think that's a good bit of homework for all of us, is to go back over those responses and see if what stands out that we may want to pursue some further discussion or talk about how we might impact those issues that got identified. Because it is a lot of data and valuable information from our social workers statewide. So the social work supervision manual, moving back to new business, we're in the process of scheduling a meeting to review that. Just need to find a time that works for Robin and Eric and I. And I'm hoping that it will not be a lengthy process. It's a relatively brief manual, and I think we can come to our meeting prepared to change or suggest whatever changes are necessary after reading through it, and maybe some additions. It might be useful for us in that process to look at what came through on the survey about supervision, so we can discuss that in our. But we're not an official subcommittee, we're just a work group. And hopefully we can get that addressed before our next meeting. I don't think we've had a chance to look at the Social Work Practice Act since our last meeting. Review and discussion on it. That I think we were going to talk about that, because to compare to the what's the word I'm looking for? The social work programs that don't that are not accredited. That's the word I was reaching for. Excuse me. To see if there were what the Social Work Practice Act actually includes, ASWB Model Social Work Practice Act. I'm sorry.
I can just make a brief comment about that with the Practice Act. In the last meeting, we did talk about that it's a fairly lengthy document, and there is some good content that we could use to kind of compare to the statutes that the BSRB has for social work, and kind of look to the Model Practice Act to see how we compare. But at the last meeting, we briefly discussed that it'd be nice to break it apart. And we asked members of the advisory committee to just review the first 20 pages of the document. So go ahead and keep that on the homework list, so to speak. And maybe at the next meeting, we could plan to just talk about the beginning of that document, go into the first 20 pages or so, and go ahead and take a look for comparison purposes to the Social Work Practice Act on the BSRB website under statute. And that way you can compare within the first 20 pages to some of the information that we have in our statutes and regulations as well.
Had you sent a copy of this to us earlier, or was it's attached to this?
The Practice Act?
Yes.
Yes, I believe it was sent out with the materials for the last meeting, and I think it was sent out with the materials for this meeting as well, but let me double check on that.
I don't think
The practice acts on there.
I think it is listed as item 6C, ASWB Model Social Work Practice Act. Now, there were a number of attachments, so on that email, you may need to use the sort of the down arrow on the attachments to get to the last one, but it's something to take a look at. So.
Can you repeat what date that was?
This was sent out just yesterday, a little about
Oh,
noon.
okay.
And so
I didn't get that.
yeah, that's the email that has the agenda and other documents. But it's also posted on the website too. If you look under the materials for this meeting and advisory committee, you can access the ASWB Practice Act that way too.
Okay, more homework. We can be better prepared to discuss that. We have on our under new business a discussion on the regulation of artificial intelligence, which is kind of a very broad topic. David, you said that some of the other advisory committees had been discussing this. So give us some idea of in what context were they discussing it? Were they discussing what they thought proposed regulations should be about it? And can you give us some examples of what you're hearing?
Yes. So this item was one of the items mentioned at the board meeting on May 13th. The board identified two topics they wanted to defer to the advisory committees to start a conversation on, and one was regulation of artificial intelligence, and then the other was the next item on the agenda as far as language concerning each of the professions. But for the regulation of artificial intelligence, basically there's been a number of items in the news recently concerning artificial intelligence and how individuals may be using that or creating items. There have been some stories about, chat boxes that may be providing services in the terms of mental health services, or people developing apps and then the apps sort of simulating providing services. And to kind of frame this, so the BSRB is limited by design. We are a state agency, so we were created by the Kansas legislature. We are created to be a public protection agency, but a lot of our statutes and regulations are written from the perspective of a person providing services, and that makes sense because historically that is all that there was. But if you look at our statutes that talk about our ability to, let's say, fine a person or limit a person, it talks about a person providing services. And if you look at the unprofessional conduct regulation, it talks about persons who are applicants or licensees in each of the professions. So what do we do if we get a complaint and there is a app that is providing ostensibly social work services and providing diagnosis and providing treatment recommendations, or providing instructions to people, and then people follow those and then they're harmed? What role should we have as a state licensing authority? And what can we do? So part of this is looking to see, okay, we're here to protect the public, and we do have a limited role, but is it possible that we could figure out sort of a way in which we can help the public when it comes to those topics? Another side of this discussion too is providing some guidance to practitioners in terms of using things like artificial intelligence in their day-to-day work. There may not be a full agreement in terms of what all constitutes artificial intelligence, but when you start to get into using AI as a helpful tool, some of those services are not a closed network. And so there's issues involved with confidentiality. There's also issues involved with disclosures. You know, if you are using something that deals with artificial intelligence, are you properly informing your clients that you're using these things and where that information that they believe is confidential, where that's going? And so a lot of the different associations have started a conversation on this topic. Artificial intelligence is something that has continued to evolve, you know, behind the scenes. And so in part, we're kind of having this discussion to try to catch up with where people are. But also a lot of, like I said, a lot of the states and associations are starting to put together task force and committees to address this topic. So we're right in line in terms of that. It's just kind of, I think the board needs to have a good conversation on this topic, but they thought this could be a really good conversation topic for the advisory committees. And then maybe the advisory committees could forward recommendations back on maybe proposals. Additionally, some of the other advisory committees, someone, you know, in one of the advisory committees mentioned, well, if we know someone who's an authority on artificial intelligence in this area, would it be helpful to connect them to you to maybe be a guest speaker at one of the advisory committee meetings to inform the members of the advisory committee, or so that we can educate ourselves in terms of what is artificial intelligence or what is being used out there. So if you do know of that, just feel free to connect me to them, and I'm happy to reach out and see about their availability. So, Jane, do you have a question?
Well, I wanted to make a comment. I just attended the National Children's Alliance Leadership Conference and attended an artificial intelligence in healthcare and in Child Advocacy Center throughout our disciplines. And so I learned a lot about the Chat GPT. And one of the things the White House is doing is they are presenting an artificial intelligence executive order on implications for behavioral health is what it is. And so because we do know that it continues to grow, and how we deal with that, because these chats, and Eric's probably a perfect example of being able to describe all this Chat GPT from a educational standpoint that they're dealing with. But I would say if you can get into a conference or training, online training, educate yourself on it, because it was eye-opening, and it is our future, but it's also an opportunity for malpractice, lawsuits, everything else coming down the road. So I would absolutely say get educated on this subject, because it's here. Children are dealing with it daily from these bots that are getting into even like YouTube Kids. We are dealing with one right now that a puppet is coming in and telling them how to harm themselves. So this is dangerous stuff. So you need to be educated, I think, as a board and advisory council on it.
Well, as far as what the board could do on any recommendation from any of the advisory committees, like David said, I think that it seems to me the first level is for there to be some regulation of that those apps that people may be using are not licensed mental health care. And so there needs to be a requirement that disclaimer, just like you have a black box warning on a drug, you know, that this is not licensed mental health care. You may be free to use it, to choose it, but it needs to be a very strong informed consent. And because we can't, as a board, regulate a computer or regulate an artificial intelligence. But I don't know, can we make a recommendation as a board that such legislation be considered?
I mean,
I,
go
I
ahead.
was,
Go
Go
ahead.
ahead, Eric.
I was just gonna say, I sent David a link to an AI training I went through for the University of Kansas that he can share with the group or reach out to Michelle. But it was actually a really good training and kind of walk through some of those, um, ethical pitfalls, things like that. So that University of Kansas may be able to come give us a overview of that presentation perhaps and help everybody kind of get the same information.
I think it's real important to be educated first on this subject before you start, suggesting what regulations need to go, because it is huge. It's just huge.
Yeah, I would
Well,
mention that there are many different apps that people do use, like a mindfulness app, and the app would remind a person of how to walk through and do a mindfulness. And so it isn't necessarily looking at the entire spectrum. It could be little pieces. And so someone says, "Well, I found this helpful," and they tell a friend, "Oh, I found this helpful." And maybe it may not be helpful if you were looking at a treatment plan for someone. So I think it is something. I don't want to say it's insidious, but it is already creeping in and has. Some of the earliest programs that were written, ELSA, ELISA, was a really crude question. You pose a question and the robot or the computer would spit out an answer. And that was back in the 1980s. So I mean, it has been going on, and things are happening, and it's going rapid. I'm not sure what kind of regulations or rules we'd be able to recommend. But if we take credit for something that we write and we have AI write the article or write the treatment plan, I think that's going to be a problem when, it gets to those levels. So,
well, that's happening in medical, where they're using artificial intelligence to diagnose, inputting all the data and imaging and whatever. So we might have to look that direction to see how other fields are regulating the use of that before we would be able to, or
right.
to help us figure out what, if anything, we might recommend. Those apps are widely available and people use them on their own and can seek them out on their own. Our issue as a regulatory board would be, licensed
The safety factor.
practitioners recommending those or
Right.
including them in a treatment plan. And, at this point, I don't think there's any parameters around that. And I think lots of practitioners do recommend some of those apps as adjunct to the therapy that's happening or whatever other treatment is going on. Is that something that we should leave in the judgment of the practitioner who's duly licensed and has, particularly someone who's licensed at the independent level, who's supposed to be capable of independent judgment about treating their clients, et cetera? Or do we think about putting parameters around there? Because again, it is growing so fast that
Right.
is with our regulatory process, by the time we got any regulations in place, things would already have gone leap years beyond whatever
Right.
we were trying to regulate as
That's
fast
right.
as AI is growing.
Yeah, and I think of things like biofeedback. These sensors can tell you're breathing and you're trying to help someone deal with anxiety. It could be a great tool to help a person reduce their level of stress at different moments when they feel themselves. So yeah, it's very difficult. And that's what I'm saying. I think it's going to be more of a creep in rather than all of a sudden AI is going to be doing everything, so to speak. But anyway, I don't know what we do from here.
Yeah, I think there are some natural extensions, I mentioned our scope of authority generally is over person.
Right.
There is a legal or a logical extension that if you are a practitioner and you create something, kind of, there's that term fruit of the poisonous tree kind of thing.
Yeah.
If you create something and then it does something and someone is harmed, you are still accountable for the things that you create and put out there. Um, so there is that. One of the things that others, the advisory committees have talked about, and we was talked about here too, is children using certain devices. And a lot of the technology doesn't reach everyone at the same time. And so a lot of the newer technology is reaching, a younger audience earlier, and then it only really gets well known once it gets to a certain level. And so, and some of the technology, in the past, one of the things that gave me a little bit of peace is that it seemed like one of the things that the computers or the robots or AI couldn't really do well was sarcasm. So, for example, if you were to ask somebody, "Oh, how are you doing today?" and someone in a session were to say, "Oh, I'm doing great." Well, the practitioner would say, "Oh, clearly they're not." But if you were just to put that text in as an input for a machine, it would say they're doing great, and the machine could say, "Great, I'm glad to hear you're doing well." But that level of sarcasm. But I've seen some devices recently that at least are able to simulate things like sarcasm and are getting a lot smarter. And so, yeah, things have progressed and things, have moved to a point to where, some of these things you start to go down a road and it is just kind of a fun device or a toy, and then you get far enough down and you just kind of wonder, are people, following some of the direction that they're getting from these apps or from these chat bots, and that's kind of the danger, I think.
I do know in this executive order from the White House, they have issued the Department of Health and Human Services to establish a safety program to receive reports and act to remedy harm or unsafe healthcare practices involving AI. So that might be a resource.
Again, by those wheels turn very slowly. So, they'll eventually come out with some recommendations, but if the executive order is happening now, I wouldn't be looking for the reports to have been received and the guidelines to have been established for a few years, probably.
I think it was October 23. So I think we're just talking about it a little bit later than what it's been on the minds of us.
HHS, yeah. Well, it's good that it's on the radar, but of course, unfortunately, those things are also subject to political changes. So if we have a change of power, then that could get quashed.
I'll try to do a little bit of research on that topic and bring some information back to the advisory committee concerning that executive order and see if anything.
Yeah, I sent you a link.
Okay, great.
Excellent. And I would really like to find out about that program Eric was talking about from KU, the training, AI training. David, if you could.
I'll forward that information as well.
Okay. And I don't know if we could have access to that, the rest of the committee, or if they could, the training itself.
Oh, well, I'm not sure. I'll have to look into that a little bit more. It looks like it was set up as an hour and a half CEU, but
okay.
But I don't know the professor who was doing that. Maybe I could reach out to him and see if there's other opportunities to share some of that information. So.
Yeah, that would be great.
Okay.
Well, huge topic.
Mm.
I think regulatory boards will probably be discussing this for many years into the future.
I do want to thank the advisory committee for starting this discussion, though. As a composite board, that's not the way that all boards are set up in other states, but it is really valuable. In Kansas, the board meetings, a lot of the work at the official board meetings is more business, going through and adopting delegation motions and approving and taking care of votes. Then we have a limited period of time. And so a lot of the helpful recommendations that get forwarded to the board come from the advisory committees. And having these standing advisory committees for each of the 7 professions is a really, like, this is really helpful for the board to have all of you come together and to research these topics and to have these types of discussions. And then that way, the different views of each of the 7 professions can get forwarded back to the board. The board can kind of take a vote after learning from each of the advisory committees. So it's neat to see this from my perspective, and I attend each one of the 7 advisory committees, so I hear all the different discussions, but I appreciate all of you participating in this because it really is valuable and helpful for them.
Thanks, David. Any other comments before we move to our next topic? Okay, well, this is one to be continued, obviously. So yeah, we've touched on this before, the idea of adding a description of each profession on the BSRB website to inform the public of the differences between the professions. So this is, it's kind of alphabet soup when you start looking at all of our credentials and the different letters after all of our names. And when I would be talking to clients about looking for a therapist, I would always try to tell them not to be too confused by that what they're looking for is someone who's licensed at a certain level and across the professions. But the question would be, who would write these descriptions? At least my question would be, who would write them, and how would you differentiate? What would you say about social work versus other professions? I know what I would tell people, but I don't know that that's what we would want to put on the website, or what any of the professions would want to say. We're different than the other professions in this way.
Yeah.
What do you all think?
And that's a really good way to kind of frame the start of this conversation. This has come up before with some of the new public board members when they start to serve on the board, and they say, I'm attending these meetings and I'm trying to do a good job as a board member, but I don't have the education and training as a social worker or as a psychologist or a professional counselor. And, we are set up as a public protection agency. And a lot of the information that we put on our website is geared towards licensees or applicants, but we also deal with, the regulation of the profession from the perspective of receipt of complaints against practitioners. And we were trying to help the public kind of have a good understanding of what is acceptable, or even what does it mean when we say that someone is a psychologist or a social worker. And so, like I said, we have information on our website. We have an FAQ section of frequently asked questions, but we're trying to approach this topic more from the perspective of the audience being members of the public. And so if they visited our website and they were trying to understand just a little bit more information about the profession, how would we explain to them what it means for someone to be a social worker? And we have the technical definitions and the statutes and regulations, but a lot of that is fueled by efficiency and terms of art. And so that may not be intuitive to members of the public. So thought it might be helpful just to kind of refer this topic to each of the advisory committees so they could start to have a conversation on maybe how could they have just, and this doesn't have to be something really long. It doesn't have to be sort of a history of the profession or all the complexities or uniquenesses. It's really more of coming up with a good, let's say, paragraph or so that we could put on the BSRB website that would just kind of explain in layman's terms what a social worker is. And each of the advisory committees is also taking up this task. So behavior analysts are also having this conversation about what a behavior analyst is. And we're hopeful that this will be something that we can use the work of the advisory committees to help make the website more helpful for members of the public.
Well, I think so. I think what I'm hearing you say is that we want a description of each profession, not necessarily a statement within that description about the ways in which it differs from the others, because I think you might have a hard time getting agreement about that. But to be able to say, what the focus is in social work and how we're trained and educated, not in terms of like years of school, but what the basically philosophy or the, the mission of social work profession versus, and then have psychology do theirs and have all the different professions talk about, what's the focus in their particular discipline. And then that the public can go and read those descriptions and see which one resonates with them if they want to have a preference about which licensed person to go with.
Yeah, and it's not so much about recommendations in terms of philosophies or practices. It's more about there's some confusion sometimes by members of the public when it comes to the term psychologist versus psychiatrist. A psychiatrist, some people use those terms interchangeably, but psychiatrists have a medical degree and are licensed by an entirely different agency, the Board of Healing Arts. And so
they're the only ones that can prescribe meds. So that's how I've normally differentiated for people.
And so we're trying to just kind of have a little short summary, and we can bring back some of the technical language from the statutes and regulations and maybe use that as a starting point. But yeah, we do get questions sometimes about someone says, well, I don't even know what a social worker is exactly. I'm trying to figure out, as a client, they're trying to figure out, what is acceptable in terms of the services I'm receiving. Sometimes they don't know if they should file a complaint or not because they don't know what the standard is because they don't understand the practice exactly. And so for people that are trained in those areas, they're educated in some of the history and different philosophies and methodology. So we're not trying to get too deep into those areas, but just something that can better inform the public about the different professions.
Well, social work is broader. And so our description is going to have to include that, social workers do a broad range of services so that people, and then it depends on what level of licensure and, who does what setting. So it's going to be harder to come up with a succinct description, I think, for social work for people to understand those differences. Go ahead, Jane.
I'm sorry. One of the things that I think about as you talk about that is, of course, I'm sitting in a very large community mental health center, so we have just about everything here. And when we get into discussions with our own colleagues, one of the things that one of the individuals that really just got me was the fact that she sees social workers as just a group of bleeding hearts out there taking care of social services. That is the farthest thing from, our profession. I mean, yes, Jane Hull started, Jane Addams started the world in social work. But we're therapists, we have so much more. And so I think what you're talking about is a good idea, but I think we have to be careful with the language because we are just one of a chosen profession that we chose to go this route instead of psychologists or LPC or anyone else. But we all do the same work. And so I think language is going to be huge on this. Simple and easy language.
I think it inspires people too about what level then they want to achieve if that's the goal that they're wanting to obtain to help other people. So I think those people like myself, like in the beginning as a bachelor social worker, what does it actually mean in the field that we want to practice, what that master's level would bring to us to help us accomplish that.
So that would be useful for people considering going into the professions to read those descriptions. And yeah, I think we want to acknowledge and include all the different areas that social workers practice in, while emphasizing that, all of the professions that have an independent level of clinical licensure are licensed and competent to do the same work. And we come at it from a different perspective. You know, we do person and environment. You know, we see problems within and without, and address within and without, even as clinicians. You know, I went to lots of IEP meetings as a clinician, even, and as previous to that as a school social worker. So there's different ways that we address clinical work, but we're all licensed and competent to do that work at that level, all the different professions. So I don't know if there could be a general statement, you know, at the beginning of this that would state something like that. That's what I would always tell people verbally when they would ask me about looking for a therapist.
Yeah, I think it is complex, but I think a public person coming onto the board, they're confused, you know, totally. I think of like an LAC, a licensed addiction counselor, does this. And well, what's the next level do in the addiction counseling? Well, when's the Suboxone come in and how does that come in? Oh, wait, you guys don't even regulate the people who do that, but you're at an addiction center. So, I mean, I can see the confusion. And I think you start with something basic and things develop over time and more refinement happens. I don't, like David did try to say, we don't have to make it too complex, but yet you start with something and then you can flesh it out or sub-tab categories within in the future or down the road.
I think this is going to help the high schoolers wanting to go into a profession and not knowing, is it psychology because that has such a great name to it, or is it social work because we can open the door to more things? You know, they're the ones that are constantly calling us and saying, this is what I'm thinking. I don't know where to go, you know? And so, and I think this could help having those definitions on the website. I think it could help that population.
Oh, that's good. I think that's real good. I think it like the LBSW, you know, they want to do case management. Let's say that's what someone really wants to do. Another person wants to do case management, but they want to work at like Rainbow United, where they're actually working with one person or two people, you know, throughout that day. I mean, there's differences even at that entry level. But anyway, I
think
agree.
too, and Mike, I think also on that point, this is Angie, but I feel like when we first graduated back in the early days, they didn't have a lot of options for specialization. So like the certificates were coming to play, but I don't think it's as easy as it was before for those of us who are on our career and beyond to get a certificate now, because we can't qualify a lot of our knowledge base that we've already obtained. So when you guys look at those different levels as well, I think certificates that you can put on top of your LBSW license or MSW, their certifications, I think we should look at those too when we make decisions moving forward.
Right. Well, we've muddied the water. So.
Well, this is part of the conversation.
Who wants to take a stab at writing a description that we would bring back to our next committee meeting and look at as a starting jumping off point?
I recommend Jane does it for us.
Jane's going.
Jane's coming off the advisory committee.
Jane's going, oh, I'm going to miss you guys.
Yeah, we'll miss you too, Jane.
You won't have so many opinionated
I've been
comments.
hoping we get done with all the technical things we need to do, because I want to make a motion or say something too. So has someone volunteered, Cynthia?
Not that I've heard.
So David, not to put you on the spot, but did you say a little bit ago that you all would take a stab at it, or did I misremember that?
So we have the technical language from the statutes and regulations, and if there's not a better starting point, we could bring back what's in the statutes and regulations, and then we can kind of use that as a starting point to adjust and make it, you know, more readable for a common audience.
I think NASW has some definitions as well that might be useful. I can look at that and send that to you if I find what I'm remembering about their descriptions of.
I think they do, Cynthia. This is Robin with NASW.
Yeah, I think they do too. So I can send that to you, David, to add to our packet for our next meeting.
Okay. That sounds great. Well, I do appreciate all the comments today, and this is something that, we weren't planning to kind of wrap up today, but just more of something to work through with all of you at some future meetings. And I think it will be helpful to have some good information up there. And when we were first originally talking about this, we thought about, should the BSRB just take a stab and, kind of try to summarize with the technical information, but we thought this would be something good for each of the advisory committees to weigh in on from their own perspectives. And so that's kind of why we wanted to refer it to you first and then kind of work through it. So.
Yeah, I think having each profession kind of speak for itself in that regard is a good plan, considering we are such a multi-disciplinary board. How many of the other state boards have this many professions under them, David?
It
Healing arts,
Yeah, it depends on how you mean in Kansas or another state?
I mean, other states. How many other states have multidisciplinary with 7 professions under it?
There's a handful that have more of the social work, professional counseling, marriage and family therapy, and then maybe some of the substance use, or we call it addiction counseling. That some of that terminology gets a little different state to state. There are some that also include more of the psychology as well, but that's a little bit more rare when it's combined. And then there are a handful of states where they just take about 20 to 30 regulatory boards and just put them all together. They're still separate boards, but they're kind of overseen. So that gets a little bit messy because then you get an investigator who's in charge of investigating things for 20 different professions, and I couldn't even imagine that. So I kind of like our model, but a little biased as well. So
Interesting.
I think it also comes down to probably population size of the state and number of licensees. I think at a certain point, you have a lot of people, it gets pretty unwieldy. Or if you have so few, you have different levels. But yeah.
I'd like to just say move the motion or the order of business, because I'd like to have a point of personal privilege if that's possible.
Absolutely.
What I would like to say is, I know that Jane is going off the board and she has committed a lot of time, and I have appreciated working with you, Jane. I don't know, there's someone else that's also going off the committee
Angie.
at this time. Angie is, okay, and she's been very active and working very hard. I did not know if the state or the executive director's office issued like a letter of appreciation, like a certificate. In the military, we always say a certificate suitable for framing, and just kind of, but acknowledging and saying thank you, and with the signature of the executive director of possibly the chair of the board and the chair of our committee, to acknowledge, I think 12 years, Jane, or has it been longer?
8. It's been 8
years. Okay, 8 years. And for Angie, I don't know how many years there, but
I don't know. I think
say
David
thank you.
knows.
Yeah.
About 8.
I don't want to catch you off. Like, I appreciate you bringing that up. And, we were going to just say a little recognition for Jane and Angie. They both have served 8 years on the advisory committee. And so based on that, that's the maximum length you can serve. I did forget to mention earlier, the board did make a change to the advisory committee policy at the last board meeting, valuing that some individuals would like to continue to serve past the 4 terms. So one change the board made recently is the board at that May 13th meeting recommended new language that basically said if you served 4 terms on an advisory committee, you had to come off for at least a gap of 2 years. And then after the 2-year gap of service, you were eligible for 4 additional terms. So if any of you would like to come back and serve in the future after a 2-year gap of service, feel free to submit your materials next time it's opened up. But yeah, on behalf of the BSRB, Jane and Angie, I do want to thank you both. You've been excellent members of the advisory committee. I have not been here as long as some of the advisory committee members, but I've seen your work and really appreciate what you've done. And when we do have individuals come off the advisory committee, we send a certificate to them in appreciation from the BSRB. So we will be mailing each of you a certificate to show our appreciation as well.
Thank you. And I again want to just say this has been just very very eye-opening, and I've been on other state boards, but we really have made differences, I feel, in our profession. And I think it's the group that is willing to talk about things and to hash it over and to be passionate about it. So I have thoroughly enjoyed my 8 years. And I wish you well in everything you're doing for our future social work programs and licenses. So thank you.
Thank you, Angie. I'm sorry. Thank you, Jane. And then I was going to ask Angie if she would like to say anything.
I just wish my video was on so I could just show the warmth that I have for all of you, because it's been a pleasure getting to know each of you and how you viewed social work throughout this 8 years that I've been able to be on the board. And I feel like with you guys there, we're going to continue to do great work. So I really appreciate this opportunity. And I'm sorry that I've been here for 8 years, but I am glad that I was asked to join back then. And I'm glad to be a part of what you guys have made a difference with and will continue to make a difference with.
Well, thank you, Angie. We appreciate your service, you and Jane both. It's a big commitment. It's a significant amount of time. Both for the meetings and the in-between, the homework that we sometimes have to do. And we really appreciate your commitment to the profession and to regulation. You know, licensure was a huge issue. It was a huge thing when we finally got licensure, and the things that have happened since then. There's been efforts to deprofessionalize social work and other licensed professions in recent years. And so I think that just makes the work of this advisory committee and the work of the board even more important to try to maintain that professionalism and think through all of the various ways that it needs to be supported and upheld. So thank you both for your service.
Yes, thank you both.
Okay, we have just a couple minutes left. So we had as our final new business, any other topics for 2024 that we wanted to undertake. Obviously we can't address any of those, but in the last minute or two, does anyone have a topic that they've been thinking we need to take up this year? We're halfway through the year now, so. At any time, if anyone does come across an issue that you think we need to address, you don't have to wait for the meeting. You can email me or Andrea or David and ask for that issue to be put on our next agenda. Because I know you all are in different areas and you're coming across different issues all of the time. So if one arises, shoot us a message then before you move on to something else and maybe aren't thinking about it, and we can add it to our next meeting agenda. That being said, I would entertain a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
I think everybody's
Aye.
in favor. Okay.
Aye.
All right. Our next meeting's on Tuesday, August 13th. We will see you then.
Thank you,
Everybody take
everyone.
care.
Thank you.
Bye.
Thank you.
Bye-bye.